What's going on, everyone? Welcome to today's pandemic update for Monday, April 24th, 2023. Hopefully you've had a safe day since we've seen you last. Hopefully you've tested negative if you had to take a test. And let's start off with today's news. First off, as always, we start off with India. And I think we're starting to see some good news out of India now. India logs 7,178 fresh COVID cases in 24 hours and 16 deaths. Yet again, that's a lower number. We'll have to watch the full week's progression, though. It could go back up. It could just bounce off the top for a while. It could drop. Anything could happen, but as of right now, we're not seeing any new highs being achieved. Remember there for multiple weeks, it was going up pretty quickly, and it's not doing that right now. Moving on to our next story, the Mexican president, or the president of Mexico, has tested positive for COVID. This is not his first time. This is not his second time, but his third time with the virus. So, yes, the president of Mexico has tested positive for the third time. And let's read a little more about this. Mexican President Andres Manuel Lopez said on Sunday that he had tested positive for COVID-19, the third known infection, adding that while he was not seriously ill, he would take a few days off. It's only a matter of time until he has problems, and he does have a previous health history. He did have heart issues back in 2013. It says here he had a heart attack. He is 69 years old at this time. Moving on to our next story. Not sure if we covered this yet or not. I'll bring it up again if we did. Washington State will shut down COVID-19 exposure notification app on May 11th. It seems to be the theme. The original date for the end of the pandemic emergency is going to be when a lot of things end, such as the CDC transmission map, as we talked about yesterday. We knew it was going to happen only sooner or later. I mean, with the numbers that are being reported being so low, you can kind of see why they're doing this, but as you and I both know, the numbers that are reported do not tell the full tale because at-home tests are not getting reported and data is just so suppressed. Alright, moving on to this. Gordon Lightfoot cancels all planned concerts over health issues. Unfortunately, he is experiencing a health issue at this time. No details on what that involves. He is 84 years old. He's a well-known singer. If you ever hear the song Wreck of the Edmund Fitzgerald, he wrote that song. There's quite a few songs that he wrote that he's well known for. Now moving on to this. Keith Gaddis, writer of George Strait and Kenny Chesney's hits, dies at 52 years old. That's a relatively young age to die. I did not see a cause of that. I looked at several different articles. I looked at the Wikipedia page, and I was not seeing a cause of death. Alrighty, I was debating whether or not to share this. I will. It's vaccine related. It's so controversial sometimes bringing up these vaccine issues. But when it comes to Florida, it's extra controversial. Florida Surgeon General altered key findings in study on COVID-19 vaccine safety. Now, really? Who would have thought that Florida would do something like this? Alter the data to make it look like, oh, you don't need to get the vaccine. No, 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 no. These mandates are no good. No, no, no. It's not safe, this and that. Come on, cut the crap, Florida. Start taking this seriously. I know it will never happen until there's another administration in charge in Florida, but come on, cut the crap. You're risking people's lives. Moving on to this. 5 die with the Arcturus variant in UK as strain spreads globally, so we're starting to see deaths from XBB116 in the UK. That's not good to see. Moving on to this date in COVID history, April 24th, 2020. Georgia, Alaska, and Oklahoma begin to partially reopen their states despite concerns from health experts saying it was too early to reopen. These were 3 states that literally took 2 weeks to slow the spread. Literally, they were like, okay, you said 2 weeks. The 2 weeks have passed. Enough's enough. We've given you a little extra time. It's time to move on and reopen. Well, guess what? Yeah, it's now 2023, and while it's okay for things to be open, still not 100% safe. There's still COVID out there. We've entered allergy season, which includes, sneezing, itchy eyes, runny nose, coughing, all things that could also be potentially coronavirus. So when you're out there in the public and you interact with someone who's having those symptoms or any other symptoms, just take it as if they are positive for COVID and keep your distance, social distance. All right, moving on to wastewater. This is relatively interesting, to say the least. We did get an update nationally. Look at this. Green being the West Coast, remember that was slightly rising? Not anymore. It's level to slightly dropping. The others are slightly dropping now. And we did get an update from the CDC site. And honestly, I'm not seeing a lot of wastewater sites. I was going through this earlier. I'm not seeing a lot of wastewater sites that are rising. Are there some? Of course. There's always some sites in a few counties that are rising. But the vast majority are either level or dropping. You don't see a lot of orange. You don't see a lot of red. The most amount of orange we're seeing, which represents moderate to high, is in the Great Lakes. The rest of the country is low to maybe near moderate in some places. So if there was ever a time you need to do a more risky activity, now is the time to do it. Do we know when the next surge is going to come? It could start this week. It could start next week. It could start a month from now, 3 months from now. We honestly don't know when that's going to be. But right now feels much like the period after the vaccine came out back in 2021. Remember May and June? The levels were so low. And really, I think right now, even with us missing data, we're probably at our lowest levels since that time frame. But I expressed this again. I'm referencing that time frame for a reason. Not just because we're so low, but also what happened down the line that summer. We saw the massive Delta surge. And that's what I'm trying to lead up to here. At some point, we will see another surge. Because when levels are really low, that's a longer period of time since people have had an infection. And remember, not everyone's taking the booster. I mean, vaccine uptake and booster uptake is really low right now. So when we're in a low period of infections like this, immunity from the virus itself and immunity from vaccine protection, since not as many people are taking it, is starting to wear off. And once a new variant comes to town, whether it be 116 or something else down the line, it's going to have a fair advantage at a population that is not so immune to the virus, and that gives it room to potentially kaboom, explode again at some point. So I don't know when that's going to be, but at some point we are going to see an eruption of cases again across the nation. I mean, India just saw one. They're a perfect example. They had a long period of time where they did not have a big explosion. And now they did. And people are criticizing me saying, oh, but they have 1 billion people in their population. I've gotten messages saying that, this and that. Yes, but the testing's so low right now with the number of celebrities that you're seeing testing positive there. That alone is a clue that tells you they're missing tens of thousands of cases daily. Who knows what the true number is there? You don't know it. I don't know it. And the positivity is one metric you can use, but again, it's not proof. It's not foolproof. I mean, you can still get a sense just look at the celebrities. Like I said, with all the celebrities testing positive there, that alone tells us, whoa, the cases are way higher. Because remember, they test regularly. The average person does not get tested daily before a production or whatever the heck they're doing. So just keep that in mind. At some point in time, don't be fooled. At some point in time, we are going to take steps backwards, and we are going to have a surge again. Taking a look at the transmission map, 671 counties are at high transmission, 468 are at substantial, 1,393 are at moderate, 591 are at low transmission. Taking a look at the latest variants, XBB115 is in the lead at 73.6%, XBB116 is at 9.6%, XBB191 is at 7.9%, XBB192 is at 2.9%, XBB151 is at 2.2%, FD.2 is at 1.6%, and XBB is at 1%. New Jersey, check this out. This really proves what I just showed, but Again, remember, reinfections are probably not added here, and we definitely know at-home tests are not. 68 confirmed cases, probable cases, just 19. Remember, this is New Jersey. 9 million people live in New Jersey. That's a really low number. I would estimate the real number is probably closer to 150, maybe something like that, maybe double whatever this is, or a little more. But again, that's a low number. All right, moving on to Central Pennsylvania, the only hospital in Center County, Pennsylvania, Mount Nittany. They did go up to 8 hospitalizations on the 22nd, which was Saturday, and then on Sunday they went down to 7, and today they're down to 5. So not seeing a big rise there, just steady as she goes. Taking a look at New York State. Wow, look at this. New York State, only 290 cases here. Now, they only do their reinfections on Wednesday, and again, at-home tests are not included, but even at that, I gotta admit, their numbers are relatively low right now. That's not a lot of cases for New York State. Test positivity is 1.5%. The 7-day average is 1.6%. Taking a look at hospitalizations, and you're going to see something here that is very noticeable. I'm going to zoom this in to make it even easier for you to see. Hospitalizations are continuing to drop. In fact, today, they had a huge drop. They dropped by nearly 75 in one day. 686 people hospitalized, 83 people in the ICU. Again, it feels much like pre-Delta wave where everything just dropped. But at some point, and I think it's going to catch people off guard, we're going to see things go straight back up again across the country. Don't know when that's going to be. Taking a look at some international data. South Korea, 19% increase in cases, 2% decrease in deaths. India, just only 11% increase in cases. So, I mean, yeah, it's almost to the point where pretty soon they may start dropping, but we'll see. I'm waiting this full week out to call peak on India. I don't want to rush to conclusions. Weekly death change, it's still up 26% there. Japan, 18% increase in cases, 1% increase in deaths. France, cases are down 7%, but deaths are up 59%. Australia, cases down 27%, deaths down 34%. Vietnam, cases are up 312%. And they did now report 1 death versus 0, so that equals 100% increase in deaths. New Zealand, 9% decrease in cases, 32% increase in deaths. Malaysia, 118% increase in cases, 42% increase in deaths. Spain, cases are now down 7%. That's good news. And deaths are down 19%. Austria, cases down 8%. Deaths down 53%. Indonesia, cases are up 3%. Deaths are down 24%. And we'll end today on Poland. Poland cases are down 31%. And deaths are down 36%. Alrighty, that does it for today's pandemic update. Hope you enjoyed this update. I hope you found it informative. Maybe it helps keep you safe. If you liked it, give it a thumbs up. If you want to see more content like this, hit the subscribe button down below. I will see you all again next time. But until I see you again next time, stay safe and test negative. Have a great evening, everyone.